The University of Otago is embarking on an ambitious research project to better understand the mental health impact of the Christchurch Mosque attacks. Almost a year on, some are so traumatised they're not able to leave their homes or have been reluctant to seek help due to cultural beliefs. Conan Young spoke to a pair of researchers keen to ensure the help is getting to where it is most needed.
Dr. Rakaya Suleiman-Hill is a researcher and a member of Christchurch's 3,000-strong Muslim community.
You know, all of us have been touched by this. We've all had friends who were killed. We've all been involved in the response. I was not at the mosque on March 15, but I was aware of the attacks within the first 20 minutes. And so many of us sort of got together to support our community as much as we could in those early days, and this has sort of carried on right through the year.
The study she's involved in has the twin aims of finding out what is and is not working when it comes to the help people have been getting with their mental health, but also of identifying those who have yet to come forward. Dr. Suleiman-Hill has heard of some that are still too afraid to leave their homes.
In a lot of these cultures, there is stigma around talking about mental health issues, and we appreciate that, especially for men. It's very difficult for men to reach out, and so they are a key group that we really would like to make contact with.
Lead researcher Dr. Caroline Bell says the aim is to interview as many as 500 people through the course of this year, including witnesses to the shootings, the injured, the bereaved and the immediate families of these three groups.
So we've trained 16 lay Muslim interviewers from the local community, most of them from health-related backgrounds, an extremely able group of people who've put their hands up to do this work. So they will be going out and helping with the self-report measures, and will also have a specialist mental health service nurse with them.
Dr. Bell says PTSD, mood disorders and anxiety often don't show until 8 to 12 months afterwards, so now is the right time to do the research. They'll also be looking at the positive things that have come out of the attacks.
So part of the study has been including some measures of something called post-traumatic growth, which is, we know that when some people have been through a horrendous event like this, that good things can come out of it, and often they are in the way people view themselves and what's important to them. Their connection with their faith is often highlighted as being really important.
Feroz Dita took 3 bullets to his calf muscle as he lay under a pile of bodies at the El Noor Mosque, half inside and half outside the mosque, as he attempted to flee through a broken window. His faith has played an important role in helping him to come to terms with the shooting and to forgive the man responsible.
Hatred does not achieve anything. Look where we ended up with all this hate. So it's about time we denounce hatred, and we talk about love, forgiveness. It's important.
Like the researchers, Feroz Dita, who is also Secretary of the Muslim Association of Canterbury, is worried about those reluctant to come forward and seek help.
Especially widows. We had a number of them that have come from the Middle East, Pakistan, India, where culturally the men folk have been taking care of business, running households. And in their absence, in a foreign land, very little family support, they have been finding it difficult.
Dr. Bell says the circumstances surrounding the attacks are unique and their findings will be of interest to health professionals around the world. She says the mental health impact will be felt for years to come and is hoping to secure further funding to continue their work beyond this year. Kei o te tahi aho mō te hōtaka o te ahi, ko Conan Young tēnei.